Once we've identified that device that we want to use, how would you then apply this framework kind of throughout that progression of the patient so that we can, change the way that we're using the device as the patient progresses, whether it's the settings or the environment? What would your recommendations be there?
I think it depends on what feature of the device you're really trying to utilize. So if we're using a device that is going to give you assistance, right? Do you turn the assistance up high and kind of work your way down, but maintain the same activity? Would be one progression. Or you keep going, you try to start somewhere mid-level with the assistance force and sort of increase, but also increase how hard the device or how hard the task is. I think you could utilize both. It would sort of depend on where you're starting from, I suppose, with the patient in front of you. The devices do have some limits in terms of what environments you can use them in. So you have to kind of figure out where that upper limit is before you start using it, so you know kind of how close you are to it and where you really can, how far you can push it. So I think there's different strategies. Resistance, I would say, is a little bit more straightforward, where you kind of start low and kind of build, and then continue to progress the activity if you're already at the maximum resistance. Assistance gets a little bit trickier. Definitely, it's hard to know what's better. Either start low and gain assistance, but also keep the task hard, or start high and then start to pull away the assistance. That being said, I would think we always recommend training outside of the device for that carryover too. So
okay. So it's important to make sure that you have some period of time where you're training without assistance. Just to make sure that you're achieving that carryover.
It's a device they're going home with. Ultimately their function outside of the device is what we're really trying to capture. So if you don't try to carry over what the device has been guiding them to do outside of it, I think you're losing a really big window of opportunity.
This has been a highlighted clip from ReWalk's Topics in Neurorehabilitation web series. To watch the full episode, please go to the ReWalk Robotics YouTube page or visit the link in the comments below. See you next time.